Due to the graphic nature of this program, viewer discretion is advised.
Get him on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
A Swiss Mountain Dog who's about 9 years old. She's female spayed. The owner left to go to the store, came back and found her with unproductive retching, meaning trying to vomit and nothing was coming up. She defecated a little bit of loose stool, but then she seemed very agitated. And the owner had another dog that had bloated years before, so he knew right away. His wife is in intensive care, but she's a veterinary technician and knows all about this too. So what we're going to do is we're going to get sedation so that the dog calms down right away. Then we're going to get an IV in, and then we're going to decompress the stomach, and then we're going to get her into surgery within the next half an hour here. And get her into surgery and take the stomach and rotate it into the normal position, and then attach it to the abdominal wall so that she can never twist and bloat again. Her spine is up here, back legs here. This is a stomach, and it's bloated as you see, but it's also twisted on itself. The pylorus, or the opening into the intestines, is way up at the top of the screen. It should be at the bottom of the screen. So what happens is this dog was so anxious and had a lot of anxiety because the owner's wife is in the hospital and this is the primary caregiver. And so the dog is sensing some anxiety, probably was gasping air. And then being an older dog, they have looser ligaments attaching the stomach to the abdominal wall, causing the stomach to twist on itself. And then the dog cannot get out any air, can't belch, so it just keeps bloating and bloating and bloating until finally the dog would die if the owner wouldn't have found him right away. So this is a true emergency where we have to get this dog into surgery within the next hour. So that's what we're going to be working on right now. So right now they're giving a little bit of sedation so that the dog relaxes. Then they're going to get in an IV catheter, and then Dr. Shimon is going to decompress the stomach as best as possible to get some of the air out to get her relief. We are going to give her an antibiotic IV also, so that when they relieve some of this gas and the stomach untwists a little bit, all those toxins and bacteria and all the things that are in the stomach are released into circulation. We want antibiotics on board before we decompress the stomach.
You hear that hissing? That hissing right there is all the gas coming out, so we're decompressing right now.
I'm gonna grab that garbage.
No.
Okay, there's that stomach. Oh my gosh, that is huge.
Start now?
Wow, that's amazing. Oh my God. That is awesome.
I know, isn't it?
Wow.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world at our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS. We're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel. Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mukwonago, which boasts a fully matted 5,200 square foot training hall. While in Mukwonago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
All right, so this is Wiley, and we are doing a clotting time on Wiley today. He got into some rat poison a while back, and we did some therapy with him, and he's here today just to make sure that he can clot normally. Chad's gonna draw some blood. Okay, Wiley, come here. Very good. Very good.
Alright, so there are 2 different tests for clotting. There's a PT and PTT tests. They just basically test different clotting factors in your blood. So the first step is to stick one of these cartridges in the machine here. And we let this warm up for a little bit. But basically these tests are going to test how long it takes your blood to clot. The shorter the time it takes, the better, because you want your blood to clot as quickly as possible. If you are injured and are bleeding, if it is very prolonged, out of the normal range, there are things we got to worry about. Obviously, don't want to go in on a surgery on an animal with a prolonged clotting time. Don't want to do any jugular sticks for blood, things like that. So if there is a suspect prolonged clotting time in a patient, it is serious, and we do need to check that. Take our sample of blood here. It's got to be citrated blood. And just fill this little well until there's a little bubble on top like that. And then all you do is press start and the machine will do the rest. 17 seconds, and that is normal.
So good news, Wiley's tests came back normal. So he's got normal clotting times and doesn't need any more medication. So I'll go and call the owner. Okay, so this is Speedy. Speedy's here because we had to remove his eye. He came in last week and had a closed eye with blepharospasms, which is just kind of winking. And we sedated him, and upon examination we found that his eyeball or globe had ruptured, which indicates that we have to remove the eye. So we did that, and I actually did that on Friday night. And this morning he's having some post-operative complications. A lot of the times these herbivores can get gastric stasis after surgery just because of this stress. So he's got kind of a low temperature, and we've been having to feed Speedy. So he's in an incubator. We're gonna try to get his temperature up, and just going to show you his eye. This is the eye that was removed. So he's got some stitches in there, and the incision looks pretty good. He's on antibiotics and pain meds after surgery, and he does have a good eye over here, but we don't know if something happened in his cage, if he got some sort of material in his eyes or some sort of substrate in his cage, because the other eye looks like it had been irritated in the past. So we hope he does well, and we're going to just continue with supportive care.
The premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world at our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I test MECA and Dr. DACVECC for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
Hi, I'm Dr. Jennifer Bloss. I'm one of the owners of the Brook Falls Veterinary Hospital and Exotic Care. I have a business partner, Dr. Denise Follette. She's not here today, but she's the other owner. We have had this clinic for about 7 years. We bought it 7 years ago. It was a very small clinic at that time, about 1,100 square feet. And the previous owner only saw dogs and cats. We also see dogs and cats, but about half of our practice is exotic animals, and that makes us pretty unique in the area. We're one of the biggest exotic animal practices in the entire state. And we see reptiles like snakes and tortoises and lizards. We also see birds. We see parrots, we see ducks and chickens, and also a lot of wild birds and raptors and things like that. And we also see lots of small mammals. We see ferrets and rabbits and guinea pigs. So we see just lots and lots of different animals. About half of our practice is exotic animals, and we really enjoy the variety. You never know who's going to walk in with what kind of animal, any kind of day, and it really keeps us on our toes, because especially with a lot of exotic animals, a lot of the problems we see with them even today are husbandry issues, and it takes a lot of time and a lot of knowledge just to know all the different husbandry requirements for all these different animals. So if you do have an exotic animal at home, we really stress how important it is to find a veterinarian who knows how to take care of them, and make sure you bring them into the vet, even if you think they're healthy, so you can make sure that you are doing everything you can to keep that animal as healthy as possible, because we'd rather see them nice and healthy and get you on the right track than wait until your animal is sick and it's because they were on the wrong diet or the wrong temperature or the wrong lighting or something like that. At Brook Falls, we also see a lot of wildlife, and we partner with a lot of the wildlife rehabilitators in the area. We also see all the raptors and all the other critters, and mostly reptiles, at the Schlitz Audubon Center, and we take care of all of those animals as well. We do take care of some wildlife that is privately owned by individual clients who are not in a rehabilitation setting, and it's not something that we stress. It's not something that we really highly recommend. Those people need to do a lot of research so they know how to take care of these wild animals, and most of them really do not make good pets. Raccoons can open up your every single cupboard in your kitchen and empty everything out, and they can be very destructive. A lot of the wild animals that people take care of as pets, like raccoons and skunks, things like animals like that. One, they're very destructive. Two, they can all carry rabies. They all can bite, and it takes a very special kind of owner to be able to take care of some animal like that. And they also need permits to keep wild animals as pets. In the state of Wisconsin, you do need permits for most of them from the DNR. So if any people in the community have these animals as pets and they want us to take care of them, we do require them to get a permit from the DNR, because we want those animals to be legal as well. But we want to stress that yes, we do take care of wild animals that are individually owned by clients, but it takes a very special breed of person, and it takes a lot of research by that person. They take up a lot of space in your house, and they have a lot of really unique husbandry requirements. So most of them do not make great pets. So if you know someone who's got a great pet skunk, that's wonderful, but I'd go out and buy a dog or a cat or a rabbit first before you even consider getting a skunk.
So Jet is a young cat that came in on, I believe it was Sunday, and he came in with a history of possibly swallowing a needle, which is pretty common in cats. They fancy that string that it's attached to it or thread that's attached to it, and they just like shiny things, I think. But mostly it's the string or the thread hanging onto the needle. And they go after that and play with that and then swallow the whole needle. And usually, and probably 90% of the cases, the whole needle makes it down. They take the string first, and then the whole needle goes down into the stomach. So there's two ways to get a needle out. One is by putting a scope in and pulling the needle out. Second way is to go in surgically and take it directly out of the stomach by opening up the abdomen and the stomach and going in for it. These people chose to do the surgery because they figured sometimes scoping is unsuccessful, then you pay for that procedure, and then you end up having to go to surgery. So they said, no, let's just go in surgically and get that needle out. So that's what we did on Sunday, and the surgery was very successful. He's doing fine. He went through surgery well. We're going to give him to the owner and send him home. The only thing is that he's not eating yet completely, so we're going to show the owner how to syringe feed.
And here's our baby. Here he is. Here he is. You want to say hi? Yeah. We'll say hi
See if he
from the
remembers
start. Yeah, I'm sure he does. And this is what they pulled out.
The actual needle.
The needle and string. So imagine that.
Wow.
All of that. So.
How bad is that?
Incision? You want to see? It looks really good.
Will he be messing with it?
No, he has the cone on, so
Okay.
this should actually stay on, the soft cone,
Okay.
up until they come out, which is 10 to 14 days.
Okay,
So-
he's a messer. That's how he got into this.
Yeah, well,
He's a
hopefully with this, he
troublemaker.
won't get into too much more trouble. He can, at least for 10 to 14 days. So, okay, I'm gonna go get the recovery in the
Okay.
syringe and show you how we do this.
He had a. It's this long. So I never heard of that myself, but I checked and it does happen. And you gotta put away anything that seems attractive to him.
Hey, how are you? Good.
He's all ready to go.
He's all ready to go, yes, for sure. So she's going to show you how to syringe feed. Okay, we think, obviously, we're hoping this is only temporary.
Sure.
And just to get him started, he had just a little bit of a fever. And the fever might be either from the catheter, which we took out naturally, or it might be just from the suture area or from inflammation within the stomach where the needle was poking in. Okay. I'm going to actually ask you to come back here in 3 days, because we're going to recheck him, take his temperature. And then you've got 2 days of medications. And by that time, you'll be ready if we need to give more. So
And he keeps this on.
Yes.
For a
Because
while.
we don't want him to tear out his sutures. All right.
Wow.
And I'll see you on Thursday. Wow.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.